Nurses and midwives in Koforidua have defied a High Court order restraining them from embarking on an industrial action. All the nurses had left post at the time of Joy News' visit to the Eastern Regional Hospital. Correspondent Maxwell Kudeko joins us with more. Hi Maxwell, describe for us the situation at the Eastern Regional Hospital.
Well, I got to the hospital before 8 a.m. and after the time I reported at the hospital, most of the nurses who came to work last night had handed over to doctors, and they were leaving the hospital. Many who are supposed to report today for work have declined reporting. I realized that leadership of the Ghana Registered Nurses and Midwives Association were moving around some of the facilities within the municipality, ensuring that their members do not work. Even though they will not speak to us on record, they say that there's a directive that none of the district or branch executives should grant media interview as part of the rules governing the negotiations that is currently going on in Accra. When asked whether they are not aware of the High Court order restraining them from embarking on an industrial action, the leadership at the New Job in the district told us off the record that they have not been served officially. As it stands now, they don't have any official communication saying that a High Court has restrained them. They said they just saw it in the media, so it is assumed that it's one of the fake news that has been circulating. Ideally, almost all the nurses are not on duty. However, I met the head of clinicals, Dr. Foster Aponsamen, who was very busy trying to put things together. I wanted to have an audience with him, but he told me he's very busy now trying to put things together in order not to create any vacuum. So I can report that at Koforidua, the nurses are on strike.
Now, in the absence of the nurses and the midwives, Maxwell, especially at the Eastern Regional Hospital, are the patients still being treated? How different is the situation in the hospital?
I visited the OPD, but I met a lot of people waiting at the OPD. Doctors are working. I don't know which other category of, professionals who are supporting the nurses as of this morning. But the hospital is working. The only thing that is missing out is the presence of the nurses and the other groupings that works with the doctors. I met a lot of people in queue waiting to be attended to by the doctors in the various consulting rooms. So work is ongoing, but there's a lot of pressure, or a big pressure on doctors who are currently at post.
Thank you, Maxwell Kudeko, reporting there from the Eastern region. Now, you heard Maxwell there referred to how a special team has been sent by the leadership of the Ghana Registered Nurses Association in that part of the country to check and make sure that their colleagues are on strike. Let's move to the northern region now, where a task force has been organized to ensure the nurses comply with the directive as is being done in the Eastern region. Several patients who have traveled from far and near are stranded, waiting and hoping some magic happens. Here are some of the stranded patients and nurses speaking to Joy News.
We are here just to ensure that our members comply with the directive given to us from the national level. And it is just simple.
So you go home and come every alternate day for dressing.
They have collected the paper from there around 8 afternoon. They didn't
doctor has not yet. But they are telling us they are on strike, what and what. I don't really know what to do. So as now from my children, my daughter from, she's at home. When I wake up, she was sleeping. I didn't even bath.
I can see tears in your eyes. What's going through your mind?
As now, because they've not taken any care of my sister. And when she's vomiting still, the blood is coming. So I don't even know what to do. That's
We are here just to ensure that our members comply with the directives given to us from the national level. And it is just simple.
So you just heard a member of the task force sent out by the Ghana Registered Nurses Association in the Northern region earlier. You saw some of the patients who were moved to the point of tears because their loved ones could not be treated. Martina Bugri is the one who spoke to these persons. Martina has joined us on the line. Martina, help us understand the situation in the hospitals you visited. When you got there, it looks like there's a long queue of patients and there's no one really to take care of them.
Yes, in some hospitals, there are long queues, no nurse who would normally welcome you to the table, take the necessary vital statistics that they need to do, and then identify, based on your information, they identify a doctor, and then they send you a folder and get you to go to the next stage of the process, and then you see a doctor. Today, when you go, that table at all the hospitals I've visited are empty. Nobody on it. All you can see is their BP machine and books, nothing else. Now, at the West Hospital, I was told that patients started coming in very early, and because they got there and nobody was there, had already told them that there's a possibility of a strike, and at 8, they told them that the strike was coming on. People started moving, and so just a few were at the hospital. And these are people who have traveled from communities we call overseas, and some came from Languisi, that's in the Daboya Mankaragu district. And this man says that he's been having some pain in the body after he received some injections, and that is really having an effect on him. So he came in today to see if he could see a doctor. But as it stands now, it doesn't look like he would be attended to. I also met a lady there who says that she brought the sister there who is highly pregnant, and she's been vomiting with blood in it. Her case is more serious because she's already pregnant, which is already a risk, and then there is additional sickness. And so she was in tears. You know, I asked her what was running through her head. She said she doesn't know what will happen to her sister next because she's still not attended to. And so it's a dire situation in the Tamale metropolis.
Right.
Those who are inside the ward, it doesn't look like they would be there in a longer time now, because once the nurses are not there, the doctors likely will not be able to work.
Martina Bugri, thank you very much for that update to the Northeast region. Ilyasu Tanko is standing by. Ilyasu, which hospitals have you visited and what's the situation there?
Well, Daniel, I am currently at the Wale Wale Government Hospital. First, I met a lady who said she's a surgery patient and she was asked to report today for a second operation. She came and she was asked to go because the nurses were on strike. And I also met a lady who said she came with an anemic mother. And they have been in the hospital for 3 days now. Her mother was recuperating. But today, the doctor had asked them to leave and seek health care elsewhere because the nurses are on strike. And I also met a heavily pregnant woman. In fact, I'm told that she was in labor. And she was also turned away. I met her in a tricycle. She was being carried away from the hospital. I saw her in pain, and the caretaker told me that the woman was in labor, but the doctor had asked them to leave and seek health care elsewhere. At the female ward of this particular hospital, I was there. The doctor there discharged all the patients, told some of them to go to private healthcare, others to go to Boliga and Tamale.
And that is the situation. The dispensary, as we speak, is very empty. The OPD is empty. There are currently only 3 doctors currently operating there, and all that they are doing is issuing forms for these people to leave and seek healthcare elsewhere, and they are also informing them of the situation currently.
Elias, it seems like a very dire situation there. Were you able to speak to some of these doctors, and did they tell you how they're managing?
Well, I met a doctor who was operating some patients at the emergency ward. I'm told he's also the superintendent of the hospital, and he told me that the situation is very difficult for them, but like I could see him, they are trying to ensure that those that are currently at the hospital or on admission, some of them, they will be able to attend to them. And he also said that they are hoping that very soon the nurses will resolve their issue with stakeholders and come back. If not, they will be forced to discharge all category of patients in the hospital.
Elias Utanko, thank you very much for joining us.